What are reversal agents and what do you need to know about them as a nurse or an anesthesia trainee who is taking care of patients after anesthesia? In order to understand reversals, we first need to understand paralytics. But before we understand paralytics, we have to understand how our muscles contract. Muscle contraction is controlled at the neuromuscular junction. The neuromuscular junction is where the end of your nerve meets the muscle cell. We naturally have receptors at that site for acetylcholine. These are called nicotinic receptors. Under normal conditions, acetylcholine binds the nicotinic receptor and it sets off a series of events that ultimately leads to muscle contraction. In the operating room, we often use paralyzing agents called neuromuscular blockers to make it easier for the surgeon to work on their surgery. They bind to the nicotinic receptors that normally work with acetylcholine and prevent acetylcholine from doing its job. These bind muscles all throughout our body. In order for patients to be able to breathe at the end of the procedure, we have drugs that can reverse the paralysis. There are two main categories of reversals. The first type of drug is an anticholinesterase inhibitor. A common example of this is neostigmine. Anticholinesterase is an enzyme that naturally occurs in our body that breaks down acetylcholine. And neostigmine works to inhibit this. It allows acetylcholine to naturally build back up. Acetylcholine can now take back over and recompete to bind the site and essentially bump the ROC or VEC off. Acetylcholine has many effects throughout the body, including causing bradycardia. So it's important that we give this drug with an anticholinergic like glycopyrrolate. The second type of reversal agent that's much newer is called sugammadex. Sugammadex is a selective muscular relaxant binding agent. It only works with rocuronium, vecuronium, and pancuronium. Sugammadex has a cyclodextrin, essentially a sugar ring. It surrounds the molecule and encapsulates it just like Febreze. If you're taking care of a patient after a major surgery, it's having low tidal volumes, respiratory distress, weakness, or just looking kind of floppy, ask if they had adequate reversal.